Malaysia should take a risk-based approach in the implementation of the National COVID-19 Immunisation Programme as it ramps up its vaccination drive, according to public health expert Datuk Dr Lokman Hakim Sulaiman. Dr Lokman Hakim, who is the Professor of Public Health and Pro Vice Chancellor at the International Medical University, Kuala Lumpur, said to maximise the impact of the nation's current vaccine supply, vaccination of the elderly population and people with comorbidities must be expedited. He said the vaccination drive should also zoom in on densely populated urban areas with a high level of economic activities. Since COVID-19 transmissions are highly localised, people living and working in such areas face a higher risk of infection, said Dr Lokman Hakim, who is also a member of the WHO Advisory Group for Pandemic Influenza Preparedness Programme. In this regard, he added, Labuan should be given the top priority for mass vaccinations as it has the highest incidence of COVID-19 cases per 100,000 population. Dr Lokman Hakim said the government should also focus its vaccination drive on the Klang Valley, comprising Selangor, Kuala Lumpur and Seremban, which contributes to more than 50% of new COVID-19 cases in Malaysia on a daily basis. Commenting on the efficacy of the vaccines against infections caused by the more aggressive Delta and Alpha COVID-19 strains, Dr Lokman Hakim said recently published data from a Public Health England study conducted in April and May 2021 showed that the Pfizer-BioNTech vaccine was 88% effective against symptomatic disease from the Delta variant 2 weeks after the second dose was given, compared to its 93% effectiveness against the Alpha variant. Meanwhile, 2 doses of the AstraZeneca vaccine were 60% effective against symptomatic disease from the Delta variant, compared to its 66% effectiveness against the Alpha strain. Both vaccines were found to be 33% effective against symptomatic disease from Delta 3 weeks after the first dose was given, compared to around 50% effectiveness against the Alpha variant. Fittest, fastest variant. The World Health Organization considers any vaccine with at least a 50% efficacy rate is good enough for public health intervention, he pointed out. Delta is one of the 4 COVID-19 variants of concern that are being monitored globally. The others are Alpha, Beta and Gamma. The latest COVID-19 variant to be highlighted by WHO is Lambda, which first appeared in Peru in August last year. Malaysia's Health Ministry, in a tweet on July 5, said the Lambda strain has been detected in over 30 countries and is deadlier than Delta. Commenting on the Delta variant, Dr Lokman Hakim said it has been linked to the ferocious wave of COVID-19 cases in India in April and May this year when the country reported more than 400,000 new cases a day. It has also been associated with the resurgence of infections in the United Kingdom, Nepal and other Southeast Asian countries. However, he added, epidemiologically it is difficult to ascertain for sure the role of this variant considering that there are other confounding factors, such as mass gatherings and activities, for the resurgence of cases in those countries. He indicated that the biggest concern with the Delta variant is that it is the fittest and fastest among the variants that have emerged. How the public can protect themselves against the new variants. Dr. Lokman Hakim said from the public health perspective, the people must continue to be vigilant in protecting themselves and others by wearing masks correctly and avoiding crowded places and poorly ventilated rooms, as well as getting themselves vaccinated as soon as possible. Article type. Metered user type. Anonymous web user status. Campaign ID. 46C Accents type. Free user access status. 3. Join our Telegram channel to get our evening alerts and breaking news highlights.